Our bodies are always sending us signals, a constant stream of information about our well-being. These signals can be subtle whispers or more pronounced alerts, each carrying a message about our health. It's crucial to tune into these messages, to become familiar with the language of our bodies, sometimes subtle, like a persistent ache or a slight change in skin texture, and sometimes obvious, such as a lump or unusual discharge. These signals are our body's way of communicating that something might not be quite right, urging us to pay closer attention when something isn't right. It's like an internal alarm system, designed to alert us to potential problems before they escalate. Ignoring these signals can be detrimental, potentially delaying diagnosis and treatment. Learning to recognize these signals, especially for breast cancer, which is a significant health concern for women worldwide, is a vital skill. Understanding the nuances of these signals can empower you to take control of your health. Is empowering, not frightening. Knowledge is power, and understanding the potential warning signs allows you to approach your health with confidence and proactive measures, rather than fear. Early detection can save lives, offering a greater chance for successful treatment and recovery. The earlier a potential issue is identified, the more options are available and the better the prognosis. And knowing what to look for is your first line of defense. It's about being informed, vigilant, and proactive in safeguarding your well-being. This knowledge empowers you to advocate for your health and make informed decisions. Breast cancer is the most common cancer among women worldwide, affecting millions of lives each year. Understanding the prevalence of this disease underscores the importance of awareness and early detection efforts. But it can affect men too. While less common in men, breast cancer can still occur, highlighting the need for awareness across all genders. Men should also be vigilant about any changes in their breast tissue and seek medical attention if necessary. The good news is that advancements in medical research and treatment have significantly improved outcomes for those diagnosed with breast cancer. When caught early, treatment is often more effective, leading to better long-term health and quality of life. Early detection allows for less invasive treatments and a greater chance of complete remission, and recovery rates are higher. Many individuals go on to live full and healthy lives after a breast cancer diagnosis, thanks to early detection and effective treatment strategies. This guide will help you spot the early warning signs, providing you with the knowledge and tools to identify potential issues promptly. We aim to empower you with the information you need to take control of your health, so you can act quickly if something changes. Prompt action can make a significant difference in the course of treatment and overall outcome. Don't hesitate to seek medical advice if you notice anything unusual. Think of this as a tool to help you understand your body's messages, translating the subtle cues and signals into actionable insights. It's about fostering a deeper connection with your body and its unique needs. We'll break down symptoms in clear, simple terms, avoiding complex medical jargon and providing easy-to-understand explanations. Our goal is to make this information accessible to everyone. What's normal? Helping you establish a baseline understanding of your own body's unique characteristics and variations. Knowing what's typical for you is the first step in identifying any potential abnormalities. And what's not? Recognizing deviations from your personal norm is crucial for early detection and prompt medical attention. We'll guide you through the key differences to look out for. This isn't a replacement for medical advice, and it's essential to consult with a healthcare professional for any concerns or questions you may have. This guide is intended to supplement, not substitute, professional medical guidance, but it will give you the confidence to seek help when you need it. By being informed and aware, you'll feel more empowered to discuss your concerns with your doctor and advocate for your health needs. Regular self-checks and awareness of your own baseline are key to identifying any changes early on. Make self-exams a routine part of your health regimen and familiarize yourself with the normal contours and textures of your body. Every person's body is unique, with its own individual characteristics and variations. Embrace your body's uniqueness and learn to appreciate its normal state. So knowing what's normal for you is crucial. What might be considered abnormal for one person could be perfectly normal for another. Understanding your own body is paramount. By being proactive, you become your own best health advocate, taking charge of your well-being and making informed decisions about your health care. Your active participation is essential for optimal health outcomes. Early detection leads to better outcomes, increasing the likelihood of successful treatment and a return to good health. The sooner a potential issue is addressed, the better the chances of a positive resolution, and peace of mind for you and your loved ones. Knowing that you are taking proactive steps to protect your health can bring comfort and reassurance to both you and your family. Start by paying attention to your body, tuning into its subtle cues and signals, and becoming more mindful of your overall health. Cultivate a deeper connection with your physical self, and making self-checks a habit. Incorporate regular self-exams into your routine, just like brushing your teeth or exercising. Consistency is key. This journey begins with awareness and action, empowering you to take control of your health and well-being. It's a journey of self-discovery and proactive care. Let's walk through the essential signs together, providing you with the knowledge and tools you need to identify potential issues early on. We're here to guide you every step of the way. Your health is worth it. It's the most valuable asset you have, and investing in your well-being is the best investment you can make. The most common sign of breast cancer that women often notice is a lump. It's a change in the breast tissue that can be felt, and it's important to pay attention to any new or unusual findings during self-exams or routine checkups. But it's crucial to remember that not all lumps are the same. There are various types of breast lumps, and understanding the differences can help you stay informed and proactive about your breast health. Cancerous lumps are often described as hard, irregular in shape, and fixed in place, meaning they don't move easily when touched. They can feel quite different from the surrounding breast tissue. However, it's important to note that some cancerous lumps can feel softer or rounded, making it even more important to be vigilant about any changes you detect. The texture alone isn't a definitive indicator. The key is noticing a new lump or thickening in the breast area. This involves becoming familiar with the normal texture and feel of your breasts so you can identify anything that deviates from the norm. This new lump or thickening will feel different from the rest of your breast tissue. It's about recognizing a change, no matter how subtle it may seem. Regular self-exams are vital for this awareness. Most breast lumps are benign, meaning they are not cancerous, and are often caused by cysts, which are fluid-filled sacs, or non-cancerous growths like fibroadenomas. These are common and usually harmless, but you can't tell by touch alone whether a lump is benign or cancerous. A professional medical evaluation is necessary to determine the nature of any breast lump. Any new lump or change in the breast or underarm area, including swelling or tenderness, warrants prompt attention from a healthcare provider. Don't hesitate to seek medical advice. Should be checked by a doctor right away. Early detection is key in successful treatment, so don't delay seeking professional medical advice. Don't try to self-diagnose the lump. Rely on the expertise of medical professionals to accurately assess the situation and provide appropriate guidance. Regular self-exams help you know what's normal for you, allowing you to establish a baseline understanding of your breast tissue and its characteristics, making it easier to spot changes, no matter how subtle. This familiarity empowers you to take proactive steps in maintaining your breast health. Lumps can appear anywhere in the breast tissue or in the underarm area, as breast tissue extends into the armpit region. Be thorough in your self-exams, and it's important to remember that most cancerous lumps aren't painful. The absence of pain doesn't mean a lump is harmless, so don't let that deter you from seeking medical attention. If you find a new lump, no matter the size or location within the breast or underarm, it's essential to take it seriously and seek professional medical advice. See your healthcare provider as soon as possible. Don't delay in scheduling an appointment for a thorough examination and evaluation. Early evaluation is always safest and provides the best chance for successful treatment if the lump turns out to be cancerous. Remember, your body is sending you a signal when you notice a change. Don't ignore it, even if you feel anxious or uncertain. Trust your instincts and act promptly by scheduling an appointment with your doctor. Your health is a priority, and early action can make a significant difference. It could make all the difference in your long-term health and well-being. Early detection and treatment are crucial for positive outcomes. We often hear about lumps as the primary warning sign of breast cancer, and while they are important to be aware of, they're not the only indicator. It's crucial to understand that changes beyond lumps can also signal potential issues. Changes in breast size or shape matter too. These alterations, even without a palpable lump, can be significant and warrant attention. It's about being attuned to your body and recognizing what's normal for you. Watch for one breast becoming larger, paying close attention to any noticeable increase in size that seems out of the ordinary. This could be a gradual change or a more sudden development. Lower, noticing if one breast appears to be drooping or positioned differently than it used to. or fuller than the other, observing any changes in volume or density that create an imbalance between your breasts, especially if it's a new change. Any recent or unusual alterations should be promptly evaluated. Don't dismiss something just because it doesn't fit the typical lump scenario. Tumors can cause swelling, leading to a generalized increase in breast size or a localized area of puffiness, or alter the breast's contour, resulting in an uneven or distorted appearance. Look for any unusual bumps, ridges, or indentations along the breast's outline. Even if you can't feel a lump, changes in texture or firmness without a distinct mass can still be indicative of underlying issues. Visual self-checks are just as important as feeling for lumps. Take the time to carefully observe your breasts in a mirror, paying attention to their overall appearance. Look for new asymmetry, flattening, or indentations. These visual cues can be subtle but significant indicators of changes within the breast tissue. These can signal something beneath the surface. Don't dismiss these visual changes as insignificant. They could be the first sign of a developing problem. A dimple or dent, a small pit or depression in the skin, can be a sign of underlying tissue changes, especially when moving your arms is a red flag. This movement can accentuate subtle changes that might otherwise go unnoticed. Many women have naturally uneven breasts, and a slight difference in size is perfectly normal and not usually a cause for concern. But sudden changes are what matter. It's the asymmetry or alteration that should prompt further investigation. If you notice a new difference in size, even a subtle one, it's worth bringing to the attention of your healthcare provider. Shape or contour. Any deviation from what's typical for you should be considered a potential warning sign. Consult your doctor. They can perform a thorough examination and determine if further testing is necessary. Don't wait for it to go away on its own. Procrastination can delay diagnosis and treatment, potentially impacting outcomes. While some changes are harmless and may be related to hormonal fluctuations or other benign conditions, it's always best to err on the side of caution. Others can be early signs of cancer. Early detection is key to successful treatment and improved survival rates. Your vigilance is your best defense. By being proactive and aware of your body, you empower yourself to take control of your health. Regular checks help you spot changes early. Make breast self-exams a routine part of your healthcare regimen. Take action if you see something new. Don't hesitate to reach out to your doctor with any concerns, no matter how small they may seem. Your nipples can reveal important clues about breast health. Sudden nipple inversion, where a previously outward nipple turns inward, should be checked immediately. Unusual nipple discharge, especially if clear or bloody and from one breast, is a concern. Changes in the nipple or areola, scaly, red, or crusted skin can signal rare cancers like Paget's disease. Persistent nipple irritation or pain, not linked to your cycle, deserves attention. Don't dismiss new or ongoing changes. If something looks or feels different, see your doctor. Early evaluation is key. Your nipples are a vital part of your breast health story. The skin on your breast can signal trouble beneath the surface. Watch for dimpling or puckering. Skin that looks like an orange peel, peau d'orange, is a classic warning sign. Redness, rash, or warmth that doesn't go away could indicate inflammatory breast cancer. Persistent sores or ulcers that don't heal are serious and need prompt evaluation. Notice if veins on one breast become more visible. This can signal a blockage or tumor. Don't ignore changes in color, texture, or thickness. During self-exams, look as well as feel. If you spot unusual skin changes, see your doctor quickly. Your observation could lead to early life-saving treatment. Trust what you see. Pain isn't a common early sign of breast cancer, but persistent discomfort shouldn't be ignored. If you have ongoing pain in one spot, breast or armpit, that isn't linked to your cycle or an injury, talk to your doctor. Swelling, with or without pain, is another warning sign. A heavy, full, or tight feeling in the breast, or swelling in the armpit or collarbone area, can signal cancer spreading to lymph nodes. Sometimes, swelling is the first sign, even before a lump appears. Swollen, hard lymph nodes in the armpit or near the collarbone need immediate attention. Listen to your body. Persistent pain or swelling is a reason to act. Don't wait for symptoms to resolve on their own. Early action can lead to better outcomes. Your comfort matters. Don't ignore what feels off. Trust your instincts and seek help. It's always better to be sure. If you notice any warning signs, see your doctor promptly. The process starts with a clinical breast exam and a review of your medical history. Imaging tests like mammograms and ultrasounds help doctors see inside the breast. Mammograms are detailed X-rays. Ultrasounds use sound waves to distinguish solid lumps from cysts. If something looks suspicious, a biopsy is next. A small tissue sample is taken and examined for cancer cells. Waiting for results can be stressful, but it's the only way to get clear answers. If the biopsy is benign, you get peace of mind. If it's cancer, you and your doctors can plan the best treatment. The diagnostic process is thorough to ensure you get the right care. Don't delay. Early diagnosis is crucial. Your health team is there to support you every step of the way. Not all breast cancers cause symptoms early on, that's why regular screening is essential. Screening tests, like mammograms, can find cancer before you feel or see any changes. Early detection means smaller tumors, less spread, and better treatment outcomes. Most women should start regular mammograms at age 40, but your doctor can tailor a plan based on your risk. If you have a strong family history or genetic risk, you may need earlier or additional screening, like MRI. Talk to your doctor about your personal risk and the best screening schedule for you. Don't wait for symptoms. Be proactive. Screening is a routine part of good health, like annual checkups. It's an investment in your future. Early detection saves lives. Make screening a priority. We've covered the key signs of breast cancer and how doctors diagnose it. This knowledge empowers you to take charge of your health. If you notice a new lump, change in shape, unusual discharge, or skin dimpling, see a doctor. Don't wait. Early action gives you more options and a better outlook. Remember the 3 pillars: know your risk, get screened, and know what's normal for you. Talk to your family about health history and work with your doctor on a screening plan. Regular self-checks help you spot changes early. These steps put you in control of your health journey. Encourage others to do the same. Share this knowledge and support one another. By committing to early detection, we face breast cancer with confidence and hope. You have the power to make a difference in your life. Take that first step today. Your future self will thank you.
The sun, our nearest star, is a source of life, radiating energy that sustains our planet. It provides us with light, the very essence of visibility and vibrancy in our world. And it's crucial for our health, enabling our bodies to produce vitamin D, essential for bone strength and overall well-being. But lurking within its life-giving rays are hidden risks that we must acknowledge and understand. While sunlight feels incredibly good on our skin, warming us and lifting our spirits, it constantly emits ultraviolet UV radiation, an invisible form of energy that can have significant effects on our bodies. This UV radiation is the main cause of sunburn, that painful reminder of overexposure. But the damage goes deeper, contributing to premature aging, causing wrinkles and loss of skin elasticity, and most seriously, it's a leading factor in the development of skin cancer, a potentially life-threatening disease. Our skin, the largest organ in our body, acts as a remarkable shield, protecting us from the outside world. But despite its resilience, it's not invincible against the constant assault of UV radiation. Every unprotected moment we spend in the sun adds up, contributing to the cumulative damage our skin endures. This exposure slowly damages our skin cells at a microscopic level, weakening their structure and function. Over time, this cumulative exposure takes its toll, leading to visible signs of aging and increasing the risk of more serious problems. The UV radiation can penetrate deep into the skin, altering DNA, the very blueprint of our cells. This damage can lead to uncontrolled cell growth and ultimately the development of skin cancer. Therefore, sun protection isn't just for those long, lazy beach days, it's an everyday necessity. It should be a daily habit, as routine and automatic as brushing your teeth each morning. Respecting the sun's power means enjoying the outdoors wisely, taking precautions to minimize the risks. It's about finding a balance, enjoying the benefits of sunlight without exposing ourselves to excessive harm, not avoiding it altogether. By understanding the risks associated with sun exposure and taking simple precautions, such as wearing protective clothing and applying sunscreen, you can protect your skin for life, ensuring its health and vitality for years to come. This guide will provide you with the knowledge and tools you need to recognize skin cancer in its early stages, spot warning signs that may indicate a problem, and take practical steps to stay safe and minimize your risk. Let's explore in detail what skin cancer is, how to detect it early, and what treatment options are available. And most importantly, let's learn how to protect yourself and your loved ones from the harmful effects of the sun, ensuring a healthy future for all. Skin cancer is the uncontrolled growth of abnormal skin cells, usually triggered by UV damage. Our skin has 3 layers: the outer epidermis, the middle dermis, and the deep hypodermis. Most skin cancers start in the epidermis, which contains basal cells, squamous cells, and pigment-producing melanocytes. The type of cell affected determines the cancer, basal cell carcinoma, squamous cell carcinoma, or melanoma. Each type looks and behaves differently, so knowing the difference is crucial for diagnosis and treatment. Not all skin spots are cancerous. Many are harmless moles or freckles, but any new or changing spot deserves attention. Skin cancer is often visible, giving you a unique chance to catch it early. By knowing what to look for, you can take charge of your skin health. If something seems off, consult a doctor promptly. There are three main types of skin cancer: basal cell carcinoma, BCC, squamous cell carcinoma, SCC, and melanoma. BCC and SCC are the most common, often appearing on sun-exposed skin and usually less aggressive. Melanoma is rarer, but far more dangerous, responsible for most skin cancer deaths due to its ability to spread quickly. BCC may look like a pearly bump or a sore that won't heal. SCC often appears as a scaly patch or firm red nodule. Melanoma is linked to moles and follows the ABCDE rule: asymmetry, border, color, diameter, and evolution. Early detection is key. While BCC and SCC are highly treatable, all skin cancers need prompt attention. Recognizing the differences helps you act quickly and seek the right care. Every suspicious spot deserves a professional check. Basal cell carcinoma, often referred to as BCC, is the most prevalent form of cancer worldwide. It's a type of skin cancer that originates in the basal cells, which are responsible for producing new skin cells as old ones die off. Understanding BCC is crucial because of its high occurrence rate and potential impact on health. It is usually slow-growing, often taking months or even years to develop noticeably. This slow progression offers a significant advantage. It's highly curable, with excellent success rates if caught and treated early. Early detection is key to preventing more invasive treatments and potential complications. However, if left untreated, BCC can invade and destroy nearby tissue. The longer it goes unnoticed, the more damage it can inflict, potentially leading to more extensive and complex treatments. This invasion can cause significant disfigurement, especially when the cancer is located on the face, where it can affect appearance and self-esteem. The face is a common site for BCC due to its frequent exposure to the sun. BCC may initially appear as a shiny, pearly bump on the skin. This is one of the most common presentations, often mistaken for a pimple or other minor skin condition. In other cases, it can manifest as a flat, scar-like patch that is slightly raised or discolored compared to the surrounding skin. This type can be easily overlooked, as it doesn't always present with a noticeable bump. Another common sign is a sore that won't heal, often crusting over and bleeding intermittently. These sores can persist for weeks or months without showing signs of improvement, which should raise a red flag. Squamous cell carcinoma, or SCC, is the second most common type of skin cancer. It arises from the squamous cells, which make up the outer layer of the skin. SCC is often found on areas of the body that receive the most sun exposure, such as the face, ears, neck, scalp, and hands. These areas are particularly vulnerable to UV damage, which is a primary cause of SCC. While still highly treatable, SCC is considered slightly more aggressive than BCC. This means it has a higher potential to grow more rapidly and invade deeper tissues if left unchecked. In some cases, SCC can spread to other parts of the body if ignored, a process known as metastasis. This can involve the lymph nodes and other organs, making treatment more challenging. SCC often presents as a rough, scaly patch of skin that may be slightly raised. These patches can be itchy or tender to the touch. It can also appear as a firm, red nodule or bump on the skin. These nodules may grow over time and become more prominent. Similar to BCC, SCC can manifest as a sore that bleeds easily and doesn't heal properly. These sores may persist for several weeks or even months. Certain factors increase your risk of developing both BCC and SCC. These include fair skin, a history of frequent sunburns, and cumulative sun exposure over your lifetime. Prolonged exposure to the sun's harmful ultraviolet UV rays is a major contributor to the development of both BCC and SCC. Other risk factors include a weakened immune system and exposure to certain chemicals or radiation. Regular skin checks, both self-exams and professional screenings by a dermatologist, are your best defense against these types of skin cancer. Early detection significantly improves treatment outcomes. During these checks, look for anything new, changing, or unusual on your skin. This includes moles that have changed in size, shape, or color, as well as any new growths or sores that don't heal. Early treatment is crucial for preventing complications, minimizing scarring, and ensuring the best possible outcome. Various treatment options are available depending on the type, size, and location of the skin cancer. Don't ignore persistent or unusual skin changes. Get them checked by a dermatologist or healthcare professional as soon as possible. Prompt evaluation and diagnosis are essential for effective management of BCC and SCC. Melanoma is the deadliest skin cancer, responsible for most skin cancer deaths despite being less common. It starts in melanocytes, the pigment cells, and can appear as a new spot or a change in an existing mole. Melanoma spreads quickly, making early detection critical. Intense, blistering sunburns, especially in childhood, raise your risk. Melanoma can develop anywhere, even on areas rarely exposed to the sun. Know your skin's pattern of moles and spots. If you notice a new, changing, or unusual spot, see a dermatologist immediately. Early action saves lives. Anyone can get skin cancer, but some factors raise your risk. The biggest risk is UV exposure from the sun or tanning beds. Fair skin, light hair and eyes, or skin that burns easily are more vulnerable. Tanning beds are especially dangerous, increasing melanoma risk after just one use. A personal or family history of skin cancer, many or unusual moles, and a weakened immune system also increase risk. People with darker skin can still get skin cancer, often in less obvious places. The more sunburns you've had, especially as a child, the higher your risk. Know your risk factors and discuss them with your doctor. Stay vigilant, especially if you have multiple risk factors. Awareness is the first step to prevention. Early detection starts with you. The ABCDE rule helps spot melanoma asymmetry, irregular border, varied color, diameter over 6 mm, and evolution. Any mole or spot that changes, bleeds, itches, or looks different should be checked. For BCC, watch for shiny bumps, non-healing sores, or scar-like patches. SCC may show as scaly red patches, firm nodules, or wart-like growths. Perform monthly head-to-toe skin checks using mirrors for hard-to-see areas. Get to know your skin's normal appearance. If you spot something new or changing, act quickly. Don't wait for pain. Skin cancer is often painless. When in doubt, see a dermatologist. If you find a suspicious spot, see a dermatologist for a full skin check. They may use a dermatoscope to examine the lesion closely. If cancer is suspected, a quick skin biopsy is done, removing a small tissue sample for lab analysis. Most BCC and SCC are treated by surgical removal, often in a simple office procedure. Early or superficial cancers may be treated with freezing topical creams or scraping. Mohs surgery is used for complex or high-risk cases, removing cancer layer by layer. Melanoma is treated with surgical excision. Advanced cases may need immunotherapy or other treatments. Your doctor will tailor treatment to your specific needs. Prompt diagnosis and treatment are crucial for the best outcome. Protecting your skin is a lifelong commitment, and it all starts with prevention. Early detection is equally crucial. It's about being proactive, vigilant, and informed so you can catch any potential problems early on, when they are most treatable. Make sure to use a broad-spectrum sunscreen with an SPF of 30 or higher. Don't skimp. Apply it generously to all exposed skin. Reapplication is key, so reapply every 2 hours, especially after swimming or sweating. Set a timer on your phone if you need a reminder. Complement sunscreen with protective clothing. Wear wide-brimmed hats to shield your face and neck. And don't forget sunglasses to protect your eyes. Seek shade whenever possible, especially during peak sun hours. That's typically between 10 a.m. and 4 p.m., when the sun's rays are the strongest. Avoid tanning beds completely. There's no such thing as a safe tan from a tanning bed. The science is clear. They're proven to cause skin cancer and premature aging. Make sun safety a daily habit, just like brushing your teeth. Sun protection isn't just for vacations or beach days, it's an everyday necessity, no matter the weather. Get to know your skin. Check your skin monthly for any changes. Pay close attention for new moles or changing spots, freckles, or blemishes. Use mirrors for hard-to-see areas, like your back and the back of your legs. Enlist a partner to help if needed. Familiarize yourself with the ABCDEs of melanoma. Be aware of the warning signs of all skin cancers, including basal cell carcinoma and squamous cell carcinoma. Schedule a yearly skin exam with a dermatologist. You might need to see one more often if you're high risk, such as if you have a family history of skin cancer or have had a lot of sun exposure. Don't wait for symptoms to appear before seeking medical advice. Early detection is key, and it truly saves lives. The earlier skin cancer is caught, the easier it is to treat. If you notice anything unusual or concerning on your skin, don't hesitate. Consult your doctor or a dermatologist right away. It's always better to be safe than sorry. Your skin is your body's largest organ and your first line of defense against the outside world. Make a conscious effort to protect it every day, year-round. Take charge of your skin health now and enjoy the benefits of healthy, protected skin for years to come.
Lung cancer. The very words can evoke a sense of unease, and for good reason. It's a formidable adversary, a disease that casts a long shadow across the globe. Lung cancer is a leading cause of cancer deaths worldwide, claiming countless lives each year. The statistics are stark, the impact undeniable. We must confront this reality with knowledge and proactive measures. This isn't a disease that discriminates. It transcends borders, cultures, and socioeconomic statuses, affecting people from all walks of life. Young and old, rich and poor, no one is entirely immune. It's a universal threat that demands our collective attention and understanding. Many assume it only strikes heavy smokers, those with a long history of tobacco use. While smoking is undoubtedly a major risk factor, it's crucial to understand that it's not the only one. The truth is, anyone can be at risk. Exposure to environmental toxins, genetic predispositions, and other factors can all contribute to the development of this disease. It's a complex interplay of variables that makes awareness so vital for everyone. The earliest signs are often subtle, easy to overlook or dismiss in the hustle and bustle of daily life. They can be insidious, creeping in unnoticed. Perhaps it's just a lingering cough that won't seem to go away, or a persistent feeling of unusual fatigue, a weariness that no amount of rest seems to alleviate. These seemingly minor issues can be easily mistaken for common ailments, a cold, allergies, or simply the effects of a busy schedule. Recognizing these early warnings is crucial. It's the first step towards taking control of your health and seeking timely medical attention, because knowledge truly is power. The more you understand about lung cancer, its risk factors, and its early symptoms, the better equipped you'll be to protect yourself. By understanding the symptoms, you can act sooner, consulting with healthcare professionals and undergoing necessary screenings. This early intervention is critical because treatment is most effective when the disease is detected in its initial stages. This guide will help you spot the signs, providing you with the information you need to identify potential red flags. We aim to empower you to understand the risks, make informed decisions about your health, and take control of your well-being. Our goal isn't to create fear, to instill anxiety or panic. Instead, our intention is to empower you to protect yourself and your loved ones, equipping you with the knowledge and tools you need to navigate this complex health challenge. Remember, small changes in your health, those subtle shifts in your body's normal functioning, can signal bigger problems. They can be the first whispers of a developing issue. Don't ignore them. Pay attention to your body, listen to its signals, and trust your instincts. Let's start by understanding what lung cancer is, exploring its origins and characteristics. We'll delve into how it develops, examining the cellular changes that lead to its formation and progression. Your health is your greatest asset. It's the foundation upon which you build your life, your relationships, and your dreams. And being informed is your best defense, your shield against potential threats, and your key to proactive health management. Let's begin this journey together, arming ourselves with knowledge and empowering ourselves to take control of our lung health. Lung cancer begins when abnormal cells in the lungs undergo a transformation, a change that sets them on a dangerous path. These cells, once functioning as part of the healthy respiratory system, begin to deviate from their normal behavior. They grow uncontrollably, dividing and multiplying without the usual checks and balances that regulate cell growth. This rapid and unchecked proliferation leads to the formation of a tumor, a mass of abnormal tissue that can disrupt the normal functioning of the lungs. There are two main types of lung cancer, each with distinct characteristics and behaviors. Non-small cell lung cancer, which is the most common form of the disease, accounting for a significant majority of cases, and small cell lung cancer, which is less common but known for its aggressive nature and faster growth rate. This type tends to spread more rapidly than non-small cell lung cancer. Knowing the specific type of lung cancer is crucial because it helps doctors choose the most effective and targeted treatment strategies for each patient. The treatment approach can vary significantly depending on whether it's small cell or non-small cell lung cancer. The lung's main job, and their vital function, is to bring oxygen into the body and to remove carbon dioxide, a waste product, from the body. This exchange of gases is essential for sustaining life. Tumors that develop in the lungs can obstruct or block the airways, making it increasingly difficult to breathe normally. This obstruction can significantly impact a person's quality of life, and causing a range of uncomfortable and distressing symptoms, such as persistent coughing, wheezing, chest pain, or shortness of breath. These symptoms can often be the first indicators of a potential problem. It's important to remember that not all lung tumors are cancerous. Benign tumors are non-cancerous and do not spread to other parts of the body, posing less of an immediate threat. But malignant tumors are cancerous and have the potential to invade surrounding tissues and organs, causing significant damage. Early detection of lung cancer is absolutely critical, as it significantly improves the chances of successful treatment and long-term survival. As cancer has the ability to spread through the bloodstream or the lymphatic system, reaching distant sites in the body and forming new tumors. This process, known as metastasis, makes the cancer more difficult to treat. Catching lung cancer in its early stages, before it has had a chance to spread to other areas, offers the very best chance for successful treatment, remission, and a return to a healthy life. Understanding these basic concepts about lung cancer sets the stage for recognizing potential symptoms, seeking timely medical attention, and making informed decisions about your health. Let's take a closer look at what factors can put you at an increased risk of developing lung cancer, so you can be proactive about your health. Knowledge is power, and understanding the risks is the first and most important step toward prevention and early detection. Smoking is the top risk factor for lung cancer, but it's not the only one. Secondhand smoke also poses a significant threat. Breathing it in exposes you to the same carcinogens as smoking. Radon gas, a colorless, odorless substance found in some buildings, is the second leading cause. Workplace exposures, like asbestos, arsenic, and diesel exhaust, raise risk, especially in certain industries. Family history matters too. Genetics can play a role even if you've never smoked. Prior lung cancer increases your risk of developing it again. While you can't change your genes, you can reduce other risks by quitting smoking and avoiding harmful exposures. Creating smoke-free environments protects everyone. Prevention starts with awareness and action. Let's move on to the early signs your body may give you. Early lung cancer rarely causes pain or obvious symptoms in its initial stages. This is one of the reasons why it can be so challenging to detect early on. The absence of noticeable discomfort or readily apparent signs can lead to a delayed diagnosis, potentially impacting treatment outcomes, making it a silent disease, often progressing without clear indications until it reaches a more advanced stage. This silent progression underscores the importance of being vigilant about even subtle changes in your health. The first signs are often easy to dismiss, attributing them to common ailments or everyday fatigue. It's tempting to brush them aside, thinking they'll resolve on their own. A cough that lingers, persisting for weeks without improvement, becoming a constant presence in your day. It might start subtly, but gradually intensifies. Mild shortness of breath, that feeling of being winded even with minimal exertion, making everyday activities feel more strenuous. You might find yourself pausing more often to catch your breath, or unexplained fatigue, a persistent sense of exhaustion that doesn't improve with rest, draining your energy and making it difficult to focus. It's more than just feeling tired. It's a deep-seated weariness. These symptoms can mimic a cold or allergies, making it easy to misinterpret them as something less serious. The overlap in symptoms can create a false sense of security, but persistence is the key warning sign. Unlike a cold that typically resolves within a week or two, these symptoms linger and may even worsen over time. Pay attention to what's normal for you. Establish a baseline understanding of your body's typical functioning. This awareness will make it easier to detect any deviations from your usual state of health. If something changes and doesn't improve, take it seriously. Don't hesitate to seek medical advice if you notice persistent or worsening symptoms. Early consultation can lead to timely diagnosis and intervention. A cough from a cold should resolve in a week or two, gradually diminishing as your body recovers from the viral infection. You should notice a clear improvement in your symptoms. But a cancer-related cough sticks around and may worsen, becoming more frequent and intense despite over-the-counter remedies. It's a persistent irritant that doesn't respond to typical treatments. Subtle changes like wheezing, a whistling sound when you breathe, or increased breathlessness should not be ignored. These changes could indicate an obstruction in your airways or reduced lung capacity. Don't explain away new or persistent symptoms. Avoid attributing them to stress, lack of sleep, or other lifestyle factors without consulting a healthcare professional. Your body is sending you a message. It's communicating that something is amiss and requires attention. Listen carefully and respond accordingly. Early action can make all the difference in the outcome of lung cancer treatment. The sooner you seek medical attention, the greater the chances of successful intervention. Think of these signs as your body's early warning system, alerting you to potential problems that need investigation. They are your internal alarms, prompting you to take action. Ignoring them is risky, potentially allowing the disease to progress undetected, reducing the chances of effective treatment. Checking them out is smart. Consulting with a healthcare professional can provide clarity and peace of mind, ensuring that any potential issues are addressed promptly. Being proactive is your best tool for early detection, empowering you to take control of your health and seek timely medical attention when needed. Next, let's break down the specific symptoms to watch for, providing you with a comprehensive guide to recognizing potential warning signs of lung cancer. Here are the key symptoms of lung cancer you should never ignore. A cough that won't go away or gets worse over time. Coughing up blood, even a small amount. Always see a doctor immediately. Shortness of breath during routine activities. Wheezing or a new whistling sound when breathing. Chest pain that worsens with deep breaths, coughing, or laughing. Unexplained weight loss or loss of appetite. Persistent fatigue that rest doesn't relieve. Recurring infections like bronchitis or pneumonia that don't clear up. If you notice any of these, especially if they persist, consult your doctor promptly. When lung cancer spreads, symptoms depend on where it goes. Bone pain, especially in the back, ribs, or hips, can signal spread to the bones. Headaches, dizziness, or weakness may mean it's reached the brain. Jaundice or pain in the upper right abdomen can indicate liver involvement. Swelling in the neck or above the collarbone may mean affected lymph nodes. New, unexplained pain or neurological symptoms should never be ignored. If you're being treated for lung cancer, report any new symptoms right away. Early recognition of these signs is vital for timely care. If you have new or persistent symptoms, don't wait. See a doctor. It's easy to hope symptoms will disappear, but early action is crucial. Prepare for your appointment by noting when symptoms started and what makes them better or worse. Be honest and thorough. Your doctor is there to help, not judge. Tests like chest X-rays or CT scans may be needed to investigate further. Only a biopsy can confirm cancer, but many symptoms have other causes. Getting checked brings peace of mind and, if needed, starts you on the path to treatment. Don't delay. Your health is worth it. Early detection is the most powerful tool against lung cancer. When found early, treatment options are more effective and survival rates are higher. Surgery, targeted therapy, and immunotherapy work best before the cancer spreads. High-risk individuals, especially long-term smokers, should ask about low-dose CT screening. Acting on early symptoms can dramatically improve outcomes. Being proactive means not smoking, avoiding secondhand smoke, and listening to your body. Early detection shifts the odds in your favor. Take charge. Don't let the window of opportunity close. Lung cancer is serious, but knowledge gives you power and hope. By understanding the risks and symptoms, you're equipped to act early and protect your health. If you notice warning signs, don't ignore them. See your doctor. Early detection can change everything, offering better treatment and brighter outcomes. Trust your instincts. You know your body best. Taking care of yourself is a gift to you and your loved ones. Make healthy choices, stay alert to changes, and be proactive. Medical advances are improving outcomes every day. Combine awareness with action for the best chance at a healthy future. Your health matters. Take charge of it. Stay hopeful, stay vigilant, and remember, you have the power to make a difference. Start today. Receiving a cancer diagnosis can feel like the ground is shifting beneath your feet. It's a moment filled with uncertainty, fear, and a whirlwind of questions. A cancer diagnosis is life-changing, but knowledge is a powerful tool. Understanding your condition, the available treatments, and what to expect can turn fear into action. It allows you to take control, make informed decisions, and actively participate in your care. Bladder cancer is a serious health concern, affecting thousands of people each year. Yet, despite the challenges, advances in treatment are constantly being made, offering new hope and improved outcomes. Moreover, the inspiring stories of bladder cancer survivors demonstrate that a full and meaningful life is possible after diagnosis. These stories offer hope and encouragement to those who are newly diagnosed or currently undergoing treatment. My goal in this program is to demystify urinary bladder cancer, to break down the complex medical jargon and provide you with a clear understanding of this disease. I want to give you clear, practical information that you can use to navigate your journey with bladder cancer. This information is designed to empower you and your loved ones. We'll cover the basics, starting with what the bladder does, its normal function, and then delve into how cancer starts, the cellular changes that lead to tumor formation, and the signs and symptoms to watch for, the early indicators that might suggest a problem. This information is your starting point for important conversations with your doctors, specialists, and loved ones who are supporting you through this process. The more you know about bladder cancer, the more empowered you'll be to advocate for yourself in your care, treatment options, and the decisions that will shape your future health. We'll discuss risk factors that may increase your chances of developing bladder cancer, diagnostic tests used to detect and stage the disease, and the various treatment options available explained in simple, easy-to-understand terms. Take your time as you go through this information. This knowledge is here to help you, to guide you, and to empower you, not to overwhelm you with complex details. Being informed about your condition lets you ask better, more targeted questions of your healthcare team, and ultimately, feel more confident and secure in your treatment plan and the path forward. So, let's begin this journey together, step by step, with compassion and understanding, so you can face the future with strength, resilience, and unwavering hope. Let's start with the basics, the fundamental role of your bladder and how it interacts with the rest of your body. We'll explore the normal function of this essential organ, setting the stage for understanding what happens when things go wrong. This foundational knowledge is crucial for grasping the complexities of bladder cancer and its development. At its core, your bladder stores urine, acting as a reservoir for waste produced by your kidneys. Think of it as a temporary holding tank, carefully collecting fluid until you're ready to release it. This is a vital job in your body. Without the bladder's storage capacity, we'd be facing constant, uncontrolled urination, which would be incredibly disruptive to daily life. It's a silent, unsung hero working tirelessly behind the scenes. The process begins with your kidneys, which diligently filter waste products and excess fluids from your blood. They then send the resulting urine to the bladder through tubes called ureters. The bladder, a muscular sac, stretches and expands as it fills, accommodating increasing volumes of fluid. When the bladder reaches a certain level of fullness, specialized nerve endings send signals to your brain, indicating that it's time to go and find a restroom. This intricate communication system ensures that urination is a controlled and voluntary process. Bladder cancer begins when cells in the bladder lining, known as the urothelium, start to grow uncontrollably, defying the normal cellular processes. This unchecked proliferation of abnormal cells can eventually lead to the formation of a tumor, a mass of tissue that disrupts the normal function of the bladder. This abnormal growth typically happens due to mutations or alterations in the cell's DNA, the genetic blueprint that governs cell behavior. These mutations can disrupt the normal cell cycle, leading to uncontrolled division and growth. The vast majority of bladder cancers, over 90%, originate in the urothelium, which is the innermost layer of the bladder wall that comes into direct contact with urine. It's important to note that not all tumors are cancerous. Some tumors are benign, meaning they are non-cancerous and do not have the ability to spread to other parts of the body. However, malignant tumors are cancerous and possess the potential to invade nearby tissues and spread, or metastasize, to distant organs through the bloodstream or lymphatic system. Therefore, the main goal of treatment is to remove or destroy these malignant cells, preventing them from causing further damage and potentially spreading to other areas of the body. Early detection and treatment are crucial to prevent them from spreading beyond the bladder, significantly improving the chances of successful outcomes. The specific type of bladder cancer, as well as the depth to which it has grown into the bladder wall, will ultimately guide your doctor's treatment plan, ensuring a personalized and effective approach. Therefore, understanding how a healthy organ can develop cancer, the mechanisms behind this transformation, is the crucial first step in your journey towards understanding the disease and making informed decisions about your health. It all starts with those tiny cells in the bladder lining, the urothelial cells, and the complex processes that can sometimes go awry, leading to the development of bladder cancer. Bladder cancer isn't just one disease, it comes in several forms. The most common is urothelial carcinoma, making up about 90% of cases. Less common types include squamous cell carcinoma and adenocarcinoma, often linked to chronic irritation. Rare types like small cell carcinoma and sarcoma exist but are very uncommon. Your doctor will use a biopsy to determine the exact type of cancer. A pathologist examines the cells under a microscope for a precise diagnosis. Knowing the cancer type is crucial for choosing the right treatment. Each type behaves differently and responds to different therapies. This detailed diagnosis is the cornerstone of your treatment plan. Many people wonder, why me, after a diagnosis? While we don't always know, certain risk factors are clear. Smoking is the biggest risk. Smokers are 3 times more likely to get bladder cancer. Exposure to industrial chemicals, especially in certain jobs, also raises risk. A personal or family history of bladder cancer, some genetic syndromes, and previous cancer treatments can increase your chances. Age and gender matter. Bladder cancer is more common in older adults and men. Chronic bladder inflammation from infections or long-term catheter use is another factor. Knowing these risks isn't about blame. It's about awareness and prevention. Understanding your risk can help you take steps to protect your health. Your body often signals when something's wrong. Listen to it. The most common early sign is blood in the urine, even if it's just a trace. This can be intermittent, so don't ignore it if it disappears. Changes in urinary habits, like urgency and frequency or pain, are also warning signs. These symptoms can mimic a urinary tract infection, but if they persist, see your doctor. As cancer grows, you might feel lower back or pelvic pain. Advanced cases can cause weight loss, fatigue, or swelling if the cancer spreads. These symptoms can have other causes, but don't self-diagnose. The key is to notice changes and consult a healthcare professional promptly. Early attention can make all the difference. If you have symptoms, your doctor will start with a medical history, physical exam, and urine tests. A urinalysis checks for blood and abnormal cells. Urine cytology looks for cancer cells. The most definitive test is cystoscopy. A tiny camera lets the doctor see inside your bladder. If something looks suspicious, a biopsy is done, often during a TURBT procedure. The tissue is examined to confirm cancer and determine its type and grade. Imaging tests like CT or MRI scans help see if the cancer has spread. This combination of tests gives your team a complete picture. With these answers, your doctors can plan the best treatment for you. After diagnosis, 2 details matter most: grade and stage. Grade describes how abnormal the cancer cells look and how aggressively they might behave. Low-grade cancers grow slowly, high-grade ones are more dangerous and spread faster. Stage tells how far the cancer has grown, whether it's on the surface or has invaded deeper layers. Early-stage cancers are non-invasive. Invasive cancers have grown into muscle or beyond. Staging uses TURBT results and imaging tests. The TNM system describes tumor size, lymph node involvement, and spread to other organs. Grade and stage together guide your treatment plan. They help predict the cancer's likely course. This information allows your doctors to create a personalized strategy for you. The path to treating bladder cancer is not one size fits all. Treatment depends on several key factors. These include the specific type of cancer you have, its grade, the stage it's in, and your overall health condition. Each of these elements plays a crucial role in determining the most effective course of action. Early-stage, non-muscle invasive cancers, which are confined to the inner lining of the bladder, are often treated with a procedure called TURBT, or transurethral resection of bladder tumor. This involves removing the tumor using a special instrument inserted through the urethra. Following TURBT, intravesical therapy is often administered. This involves placing medicine directly in the bladder using a catheter. This helps to kill any remaining cancer cells and prevent recurrence. For muscle-invasive cancers, where the cancer has spread into the muscle layer of the bladder wall, treatment options include radical cystectomy, which is the surgical removal of the entire bladder, along with nearby lymph nodes and, in men, the prostate and seminal vesicles, and in women, the uterus, ovaries, and part of the vagina. Alternatively, a combination of chemotherapy and radiation therapy may be recommended. Chemotherapy uses drugs to kill cancer cells, while radiation therapy uses high-energy rays to target and destroy the tumor. The goal of this combined approach is to try to preserve the bladder, avoiding the need for surgical removal. This is known as bladder preservation therapy. If the bladder is removed, surgery may involve creating a new way for urine to leave the body. This is called urinary diversion, and there are several different types of procedures that can be used. Bladder-sparing approaches, using a combination of TURBT, chemotherapy, and radiation, are possible for some patients. especially if surgery isn't a viable option due to other health concerns or patient preference. These approaches aim to control the cancer while maintaining bladder function. If the cancer has spread to other parts of the body, which is known as metastatic cancer, systemic chemotherapy and immunotherapy are typically used. These treatments are designed to target cancer cells throughout the body, wherever they may be located. Immunotherapy works by helping your own immune system recognize and fight cancer cells. It boosts the body's natural defenses to attack the cancer. Your oncology team, consisting of doctors, nurses, and other healthcare professionals, will carefully explain the potential benefits and possible side effects of each treatment option. The ultimate goal is to find the treatment plan that offers the best chance of controlling the cancer while also maintaining your overall health and quality of life. Remember, every treatment plan is tailored to your unique situation, taking into account your specific cancer, your health history, and your personal preferences. You'll work closely with your healthcare team to make informed choices about your treatment, ensuring that you are an active participant in your care. While not all bladder cancer can be prevented, you can lower your risk. Don't smoke. And if you do, quitting is the best step for your bladder and overall health. Avoid secondhand smoke and stay hydrated to flush out harmful chemicals. Eat a diet rich in fruits and vegetables for added protection. If you work with industrial chemicals, follow all safety guidelines. Manage chronic bladder problems with your doctor's help to reduce irritation. Be alert to symptoms like blood in the urine or urinary changes. Early detection saves lives. See your doctor promptly if you notice anything unusual. Stay informed and be an active partner in your care. By taking these steps, you empower yourself to protect your health and face the future with confidence. Some health threats are loud and obvious, but colon cancer is often silent, making it especially dangerous. It's one of the most common cancers, yet in its early, most treatable stages, it often causes no symptoms at all. The absence of symptoms doesn't mean the absence of disease. That's why awareness and proactive health management are crucial. Here's the hopeful part. When detected early, colon cancer has a 5-year survival rate of about 90%. But as the cancer grows and spreads, that success rate drops dramatically. Early detection interrupts the journey from a harmless polyp to advanced cancer. This isn't about fear, it's about empowerment. By learning the signs, understanding risk factors, and getting screened, you take control of your health story. We'll break down colon cancer in simple terms, explore symptoms, risk factors, and the most effective strategy screening. This is a conversation about hope, prevention, and the power of modern medicine. Your health is your greatest asset. Let's protect it. To fight colon cancer, you need to know what it is. Colon cancer starts in the large intestine, the final part of your digestive tract. It usually begins as small, non-cancerous polyps, especially adenomas, that can slowly turn cancerous over years. This slow progression gives us a window to act. Removing polyps before they become cancer is the foundation of screening. As polyps grow, they can invade deeper layers of the colon and eventually spread to other organs. Early-stage cancer is localized and much easier to treat. Late-stage cancer is harder to manage. That's why early detection is so important. Screening tests look for polyps or early cancer, allowing doctors to prevent or catch the disease when it's most treatable. Removing a polyp during a colonoscopy is an act of prevention. Finding cancer early means less invasive, more effective treatment. We're not waiting for a fire. We're putting out the spark. That's the power of modern medicine. Your bowel habits are a key part of your body's rhythm. A persistent change, like ongoing diarrhea, constipation, or pencil-thin stools, can be an early warning sign. It's the change from your normal pattern that matters. A tumor can partially block the colon, altering stool shape or causing a feeling of incomplete evacuation. This sensation, called tenesmus, is your body's way of signaling a problem. While other conditions can cause similar symptoms, persistence is the key difference. Don't panic at every change, but pay attention to new patterns that don't go away. Being a good observer of your body is self-care. If you notice persistent, unexplained changes, talk to your doctor. Occasional stomach aches are normal, but persistent abdominal discomfort is different. Colon cancer pain often lingers and isn't explained by food or minor illness. It can feel like cramps, gas, or a dull ache that doesn't go away. A tumor can cause partial blockages, leading to pain, bloating, or a feeling of fullness. The pain might worsen after eating or become a constant presence. It's easy to dismiss this as stress or aging, but persistent, unexplained pain is a signal to pay attention. Many conditions can cause abdominal pain, but only a doctor can determine the cause. Trust your instincts. You know your body best. If you have new, lingering discomfort, don't wait for it to get worse. Early attention gives you the best chance for effective treatment. Listen to your body and seek answers. Blood in your stool, whether bright red or dark and tarry, should never be ignored. While hemorrhoids are common, only a doctor can determine the true cause. Colon tumors can bleed, sometimes visibly, sometimes only detected by screening tests. If you see blood, get checked, don't assume it's harmless. Unexplained weight loss is another red flag. Losing weight without trying, especially 10 pounds or more, is significant. Cancer can sap your energy and appetite, leading to steady, unintentional weight loss. If you notice these changes, talk to your doctor promptly. Cancer-related fatigue is different from everyday tiredness. It's a deep, persistent exhaustion that rest doesn't fix. Colon cancer can cause slow blood loss, leading to anemia and profound weakness. The body's energy is diverted to fight the tumor, leaving you drained. This fatigue can make daily tasks feel overwhelming. It's easy to blame stress or lack of sleep, but if fatigue is new, severe, and doesn't improve, pay attention. Especially if it's paired with other symptoms, it's time to see a doctor. Don't ignore your body's signals. Anyone can get colon cancer, but some factors raise your risk. Age is the biggest. Risk rises after 45, which is why screening starts then. Family history matters. If a close relative had colon cancer, your risk is higher. Certain genetic syndromes and a history of inflammatory bowel disease also increase risk. Some groups, like African Americans, face higher rates and should consider earlier screening. Knowing your risk helps you and your doctor make the best prevention plan. It's not about blame, it's about being informed. Take charge by understanding your personal risk profile. You can't change your age or genes, but your lifestyle choices matter. A diet rich in fruits, vegetables, and whole grains lowers risk. Fiber keeps your colon healthy. Limit red and processed meats. Choose lean proteins more often. Regular exercise helps maintain a healthy weight and keeps your digestive system moving. Aim for at least 150 minutes of moderate activity each week. Limit alcohol and avoid tobacco. Both increase cancer risk. These changes work together to create a healthier environment in your body. Small, consistent steps make a big difference. Prevention is in your hands. The most powerful weapon against colon cancer is screening. Screening can find cancer early and even prevent it by removing precancerous polyps. Don't wait for symptoms. By then, cancer may be advanced. Colonoscopy is the gold standard, but stool-based tests are also available. Most people should start screening at 45. Those at higher risk may need to start earlier. Talk to your doctor about the best test and timing for you. Don't wait for your doctor to bring it up, be your own advocate. The discomfort of screening is minor compared to treating advanced cancer. Listen to your body, know your risks, and embrace screening. Make the call. Schedule the appointment. Colon cancer is serious, but it's beatable, especially when caught early. You have the power to protect your future. Take action for a longer, healthier life. Today, let's talk about something vital for every woman's health. It's a topic that deserves our attention, our understanding, and most importantly, our proactive approach. We often get caught up in the hustle and bustle of daily life, but taking a moment to focus on our well-being is paramount. Ovarian cancer. This is a condition that can be daunting, but with the right knowledge and awareness, we can face it with strength and resilience. This isn't about fear. It's about being informed and empowered. Knowledge is power, and when it comes to our health, that power can be life-saving. By understanding the risks, the symptoms, and the available resources, we can take control of our health journey and make informed decisions. Our busy lives make it easy to ignore the quiet signals our bodies send us. These signals are often subtle, easy to dismiss as just a bad day or a minor inconvenience. But these whispers can be crucial indicators of something more significant happening within. But tuning into these whispers is one of the most loving things you can do for yourself. It's about creating a space for self-awareness, a moment to pause and truly listen to what your body is trying to tell you. This act of self-care can make all the difference in detecting potential issues early on. Early detection is key, especially with ovarian cancer. The earlier we can identify any potential problems, the more effective our treatment options become. This is why regular checkups and screenings are so important, as they can help catch any abnormalities before they progress. The journey to good health starts with awareness, knowing what's normal for you and noticing when something changes. This means paying attention to your body's rhythms, understanding your usual patterns, and being vigilant about any deviations from the norm. Keeping a health journal can be a helpful tool in tracking these changes over time. This guide will help you recognize the early signs of ovarian cancer, which are often subtle and easily mistaken for less serious issues. These symptoms can be vague and easily attributed to other causes, which is why it's so important to be informed and proactive in seeking medical advice if you notice anything unusual. My goal is to empower you with information so you can confidently advocate for your well-being. You are the expert on your own body, and you have the right to ask questions, seek second opinions, and demand the best possible care. We'll walk through the symptoms together using real-life examples you can relate to. By understanding these symptoms in the context of everyday experiences, we can better recognize them in ourselves and others. For instance, persistent bloating or unexplained fatigue might be more than just stress or diet. While stress and diet can certainly contribute to these symptoms, it's important to rule out any underlying medical conditions, especially if the symptoms persist or worsen over time. By learning to spot these signs, you give yourself the best chance for early intervention. Early intervention can significantly improve outcomes and quality of life, so it's crucial to be proactive in seeking medical attention if you have any concerns. This isn't about living in fear, but about building a respectful relationship with your body. It's about fostering a sense of trust and communication with your physical self, recognizing that your body is your ally in navigating life's challenges. Honor the signals it sends, and don't hesitate to ask questions if something feels off. Your concerns are valid, and you deserve to have them addressed with respect and compassion. Don't be afraid to speak up and advocate for your health needs. Your health is your most precious asset. Protecting it is a powerful act of self-care. By prioritizing your well-being, you are investing in your future and ensuring that you can live a full and vibrant life. Let's explore what you need to know to feel prepared and in control of your health journey. Together, we can navigate the complexities of ovarian cancer awareness and empower ourselves to live healthier, more informed lives. Ovarian cancer starts in the ovaries, two small organs that produce eggs and hormones. Cancer develops when cells in an ovary grow uncontrollably, forming a tumor that can spread if not treated. Ovarian cancer is often called the silent disease because its early symptoms are vague and easily mistaken for common issues. The ovary's deep location makes tumors hard to detect during routine exams. That's why ovarian cancer is often found at a later stage. There's no reliable routine screening, so your best defense is being alert to changes in your body. Not all ovarian tumors are cancerous, but early diagnosis is crucial for the best outcome. Listening to your body's whispers gives you the best chance for a positive result. One of the most common and often overlooked symptoms is persistent bloating. It's not just a fleeting feeling of fullness, it's a continuous, uncomfortable distension of the abdomen that can significantly impact your daily life. This bloating isn't tied to a specific meal or dietary indiscretion. It's there, lingering, regardless of what you eat or how much you exercise. Unlike normal bloating from food or your cycle, which typically subsides within a few hours or days, this type of bloating is different. It's not the kind that comes and goes with your period or after indulging in a particularly heavy meal. Instead, this type doesn't go away and last for weeks, becoming a constant companion. It's a persistent discomfort that can disrupt your routine and affect your overall well-being. The duration is key here. It's not a day or two, but weeks of unrelenting bloating. Your clothes may feel tighter even if you haven't gained weight. You might find yourself reaching for looser-fitting garments as your usual wardrobe becomes increasingly uncomfortable. And you might notice a constant ache or pressure in your abdomen, a dull, persistent sensation that never quite disappears. It's not sharp pain, but rather a heavy, uncomfortable pressure that can make it difficult to concentrate or relax. This discomfort can make daily activities like sitting or bending uncomfortable, limiting your range of motion and making even simple tasks a challenge. You might find yourself modifying your movements to avoid exacerbating the discomfort. The cause is often a tumor or fluid buildup pressing on nearby organs, disrupting their normal function, and causing the persistent discomfort. This pressure can affect various organs, leading to a range of symptoms. You might see your belly become more rounded or swollen, even without any changes to your diet or exercise routine. This swelling can be subtle at first, but gradually becomes more noticeable over time. And this change won't resolve with diet or exercise. No matter how many salads you eat or how many miles you run, the bloating persists, defying your efforts to alleviate it. Everyday bloating usually has a clear cause, like eating a large meal or consuming certain foods, and goes away quickly, often resolving within a few hours. It's a temporary inconvenience that doesn't significantly impact your daily life. The key word here is persistent. It's the duration and unrelenting nature of the symptoms that set it apart from typical bloating. It's a signal that something more serious might be going on. So if bloating and discomfort last more than 2 or 3 weeks, don't ignore it. Don't dismiss it as just a minor inconvenience. It could be a sign of something more significant. This is your body's way of signaling that something needs attention, a red flag that shouldn't be ignored. It's your body's way of communicating that something is amiss and requires investigation. Schedule a doctor's appointment to discuss these changes and get a proper diagnosis. Don't hesitate to seek medical advice. It's always better to be safe than sorry. Early action can make all the difference in managing your health and addressing any underlying issues. The sooner you seek medical attention, the better the chances of a positive outcome. Don't dismiss persistent symptoms. Your health is worth it. Prioritize your well-being and take proactive steps to address any concerns you may have. Your health is an investment, not an expense. Another warning sign is feeling full very quickly after you start eating, known as early satiety. You might sit down hungry, but after just a few bites, you feel uncomfortably full. This isn't just a loss of appetite. It's a sudden inability to eat your usual portions. It can also come with indigestion or frequent stomach upset. Over time, you may lose weight without trying. A tumor pressing on your stomach can cause this sensation, making it hard to nourish yourself. If you consistently feel full after small meals for several weeks, pay attention. When combined with other symptoms like bloating or pain, it's a red flag. Don't chalk it up to stress or a sensitive stomach. Talk to your doctor. Persistent changes in eating habits deserve investigation. Changes in urinary habits, like needing to go more often or urgently, can be another clue. This isn't the same as a urinary tract infection, which usually comes with pain or burning. You might find yourself waking up at night or planning your day around bathroom breaks. The cause is often a tumor pressing on the bladder, reducing its capacity. If this change lasts more than a few weeks and isn't explained by other causes, see your doctor. Don't self-diagnose or ignore it, especially if it's paired with other symptoms. Persistent urinary changes are worth a medical check. Your vigilance could lead to early detection. Persistent pain or pressure in your pelvic area is another key symptom. This isn't just normal cramps. It's a dull, ongoing ache or heaviness that doesn't go away. You might notice it most when sitting or changing positions, or even during sex. The pain is caused by a tumor pressing on pelvic organs and tissues. If you have new, persistent pelvic pain for several weeks, don't dismiss it as just aging or female troubles. Especially if it's combined with other symptoms, see your doctor. Describe the pain clearly, location, intensity, and duration, to help your doctor assess it. Persistent pelvic discomfort is a signal to seek medical advice. For premenopausal women, changes in your menstrual cycle can be a sign. Irregular periods, heavier or lighter bleeding, or spotting between cycles should be noted. For postmenopausal women, any vaginal bleeding is abnormal and needs immediate attention. Ovarian tumors can disrupt hormone balance, leading to these changes. Track your cycle and note any persistent, unexplained changes. If your pattern shifts for 2 or more months, see your gynecologist. Specific details help your doctor decide if further testing is needed. Fatigue and back pain are 2 more symptoms to watch for. Cancer-related fatigue is overwhelming and not relieved by rest. You might struggle with daily tasks or feel drained all the time. This exhaustion can be caused by the cancer itself, poor nutrition, or emotional stress. Persistent, unexplained back pain, especially in the lower back, can also be a sign. A tumor may press on nerves or indicate the cancer has spread. While back pain is common, it's concerning when it's new, persistent, and has no clear cause. When fatigue and back pain occur with other symptoms, it's time to see your doctor. Don't ignore these signs. Your body is asking for help. Early attention can make a real difference. We've covered the key early symptoms, the subtle signals your body might be sending. It's important to remember that these are not definitive signs of ovarian cancer, but rather potential indicators that warrant further investigation. Bloating, persistent and unusual bloating, not just after a big meal. Pain, specifically pelvic or abdominal pain that doesn't go away. Appetite changes, feeling full quickly or a noticeable loss of appetite. urinary issues such as needing to urinate more frequently or feeling a sense of urgency, menstrual changes, irregular periods, or heavier bleeding than usual. It's important to note any significant deviations from your normal cycle: fatigue, overwhelming and persistent fatigue that doesn't improve with rest, and back pain. This is often lower back pain and can be a sign of something more serious. Remember, these symptoms don't always mean cancer. Many other conditions can cause similar symptoms, but persistent changes deserve attention. Keeping a journal of your symptoms can be a helpful way to track their frequency and severity. Awareness is your best defense. Being attuned to your body's normal rhythms and patterns is crucial. Listen to your body and trust your instincts. You know yourself better than anyone else. If something feels off, don't ignore it. If something new lasts more than 2 or 3 weeks and it's not improving, take action. Don't delay seeking medical advice. Schedule a doctor's appointment as soon as possible, and clearly describe your symptoms. Be specific and provide as much detail as you can. Don't hesitate to mention your concerns about ovarian cancer. It's important to be open and honest with your doctor about your fears. Early detection greatly improves outcomes. The earlier ovarian cancer is diagnosed, the more treatable it is. By paying attention and seeking care promptly, by being proactive about your health, you give yourself the best chance for a positive result. Early intervention can make all the difference. Advocate for your health. Be your own champion. It's an act of strength and self-care. Taking control of your health is empowering. Share this knowledge with the women in your life. Spread the word and empower others to be aware. Together, we can create a community of awareness and support. We can lift each other up and provide encouragement. Your health is precious. It's your most valuable asset. Protect it by staying informed and proactive. Knowledge is power when it comes to your health. You have the power to make a difference in your own life. Take charge of your health and well-being. Today, we're tackling an important topic, one that deserves our attention and understanding. It's a subject that, while not always at the forefront of public health discussions, significantly impacts the lives of many women. We aim to shed light on this often misunderstood condition, providing clarity and empowering you with the knowledge you need, but often overlooked topic, a topic that requires us to break down barriers of silence and misinformation. We want to create a space where open conversation is encouraged and where individuals feel comfortable seeking information and support. This is about empowering you to take control of your health and well-being. Vulvar cancer. We'll delve into what it is, how it develops, and what you can do to protect yourself. This isn't just about statistics. It's about real people, their experiences, and the importance of early detection and proactive care. Vulvar cancer develops on the outer part of the female anatomy, an area that's often private and sometimes misunderstood. It's crucial to understand the anatomy to better grasp how this cancer can manifest and what changes to look out for. Of the female genitals, the vulva, which includes several important structures that play a role in sexual health and overall well-being. Understanding these parts is the first step in recognizing potential problems, including the labia, both majora and minora, which serve protective functions and contribute to sexual sensation. Changes in the appearance or feel of the labia should be promptly evaluated by a healthcare professional. And clitoris. The clitoris is a highly sensitive organ, and any unusual symptoms, such as pain, lumps, or sores, warrant immediate medical attention. While rare, making up a small percentage of all cancers affecting women, it's important to remember that every case matters. The rarity of the disease can sometimes lead to a lack of awareness, which is why we're here to provide you with the information you need. Its impact can be profound, affecting not only physical health, but also emotional well-being and quality of life. The diagnosis and treatment process can be challenging, but with the right support and information, individuals can navigate this journey with greater confidence, especially if not detected early. The earlier vulvar cancer is found, the more treatment options are available, and the higher the chances of a successful outcome. Early detection is key. Regular self-exams and routine checkups with your healthcare provider can make a significant difference. Being vigilant about your health is an act of self-care that can save lives. When found soon, vulvar cancer is often highly treatable. Advances in medical science have led to more effective treatments, offering hope and improved outcomes for those diagnosed with this condition. Unfortunately, embarrassment surrounding gynecological health issues can prevent women from seeking medical attention promptly. This hesitation can have serious consequences, delaying diagnosis and treatment. or lack of awareness about the signs and symptoms of vulvar cancer can also contribute to delays in diagnosis. Many women may not know what to look for or may dismiss early symptoms as minor irritations, can delay diagnosis and make treatment harder, potentially leading to more invasive procedures and a lower chance of successful recovery. Time is of the essence when it comes to cancer treatment. We need to normalize conversations about gynecological health, creating an environment where women feel comfortable discussing their concerns with healthcare professionals and loved ones. About gynecological health, breaking down the stigma and encouraging open dialogue about vulvar cancer and other related conditions. This is about empowering women to prioritize their health and well-being. Knowledge is power. The more you know about vulvar cancer, the better equipped you'll be to protect yourself and advocate for your health. This guide will help you recognize symptoms, empowering you to identify potential warning signs and seek medical attention when necessary. Early detection starts with self-awareness and a proactive approach to your health. Understand risk factors, allowing you to assess your individual risk and take steps to mitigate those risks where possible. Knowing your risk factors can help you make informed decisions about your health. And know what steps to take if you suspect something is wrong, ensuring you can navigate the healthcare system effectively and receive the care you need. Being proactive about your health is a sign of strength, demonstrating a commitment to your well-being and a willingness to take control of your life. Let's begin this journey together, empowering ourselves with knowledge and fostering a supportive community where we can openly discuss and address vulvar cancer. Together, we can make a difference. Your body is constantly communicating with you, providing subtle cues about its health and well-being. Knowing your body and noticing changes, no matter how small they might seem, is absolutely crucial for early detection and proactive health management. It empowers you to take control of your health journey. When it comes to vulvar cancer, the symptoms can sometimes be subtle and easily overlooked, or even dismissed as something minor. That's why it's important to be vigilant and pay attention to any persistent itching, any unexplained pain in the vulvar area, or the presence of a lump or swelling, as these are common signs that warrant further investigation. Don't hesitate to seek medical advice if you notice anything unusual. It's also essential to watch for any changes in the skin of the vulva. This includes things like thickening of the skin, any unusual discoloration, such as redness, whiteness, or darkening, or the appearance of sores, ulcers, or lesions that don't seem to heal within a reasonable time frame. Any bleeding outside of your regular menstrual period, especially if it's persistent or unexplained, or any unusual discharge from the vagina or vulva, including changes in color, consistency, or odor, are also considered red flags that should be discussed with a healthcare professional. The key is persistence. If you experience any of these symptoms, it's important to monitor them closely and track how long they last. If the symptoms persist for more than a few weeks, or if they don't respond to the usual over-the-counter treatments or home remedies, it's crucial to schedule an appointment to see a doctor or gynecologist for a thorough evaluation. Incorporating regular self-exams with a mirror into your routine can be a valuable tool to help you spot any subtle changes or abnormalities early on when they are most treatable. Don't ignore any symptoms, even if they seem minor or insignificant at first. It's always better to err on the side of caution and seek medical advice. Keep in mind that many other conditions, such as infections, skin irritations, or benign growths, can sometimes cause similar issues, but it's always safest to get checked by a healthcare professional to rule out any serious underlying causes and receive appropriate treatment. You know your body best, trust your instincts, and don't hesitate to advocate for your health. If something doesn't feel right, don't dismiss it. Remember, early action and prompt medical intervention can make all the difference in achieving a positive outcome and improving your overall prognosis. Let's focus on what you might see during a self-exam or a clinical examination. Understanding what to look for is a crucial step in maintaining your health and well-being. We're going to walk through some key indicators that warrant attention and further investigation. Remember, being proactive about your health empowers you to address potential issues early on. One of the first things to be aware of is the presence of a lump or bump on the vulva. It's important to note that not all lumps are cancerous, but any new or unusual growth should be evaluated by a healthcare professional. These lumps can vary in size, shape, and texture, so it's essential to become familiar with what's normal for your body. If you notice a growth that is firm, persistent, and not healing within a reasonable time frame, it's particularly important to seek medical advice. A sore or lesion that doesn't show signs of improvement could indicate an underlying issue that requires prompt attention. Don't hesitate to consult with your doctor if you observe any changes that concern you. Any persistent or unusual findings should be checked by a doctor. A professional evaluation can help determine the cause of the symptom and guide appropriate treatment options. Early detection and intervention are key to managing any potential health concerns effectively. Open sores or ulcers that don't heal properly are also important to monitor. These sores may appear as breaks in the skin or mucous membranes and can be accompanied by discomfort or pain. It's crucial to differentiate them from minor irritations or injuries that typically resolve on their own. Sores or ulcers that ooze or bleed, even minimally, are warning signs that should not be ignored. Any unusual discharge or bleeding from the vulva warrants prompt medical attention to rule out any serious underlying conditions. Be vigilant about any skin changes in the vulvar area. Pay attention to thick, rough patches of skin that develop. These changes in texture can be subtle, but may indicate an underlying issue that requires further evaluation. Also, be aware of areas that are white, red, or darker than usual compared to the surrounding skin. Changes in pigmentation can be a sign of various skin conditions, some of which may require medical intervention. Any of these changes deserve attention from a healthcare professional. Early detection and diagnosis are crucial for effective management and treatment. Don't dismiss new growths as pimples or ingrown hairs, especially if they linger for an extended period or exhibit unusual characteristics. It's always best to err on the side of caution and seek medical advice if you have any concerns. Regular self-exams are a valuable tool for monitoring your health. They help you know what's normal for you, making it easier to identify any changes or abnormalities that may arise. Familiarizing yourself with your body's baseline allows you to detect potential issues more effectively. Any new or changing spot, regardless of its size or appearance, should be evaluated by a healthcare professional. A thorough examination can help determine the nature of the spot and guide appropriate management strategies. Think of self-exams as a way to catch problems early, when they are often more treatable. Early detection can significantly improve outcomes and reduce the risk of complications. Respect these signs and symptoms that your body presents. They're your body's way of alerting you to potential problems that require attention. Listen to your body and seek medical advice when something doesn't feel right. Early detection leads to better outcomes, improved quality of life, and peace of mind. By being proactive about your health and seeking medical attention when needed, you can take control of your well-being and ensure the best possible outcomes. Persistent itching and pain are common, but often overlooked symptoms. Vulvar cancer-related itching is usually chronic and intense, not relieved by typical creams. Pain may be constant or triggered by activities like sitting, urinating, or sex. If you're treated for common issues like yeast infections or UTIs and symptoms persist, see your doctor. Don't self-diagnose for too long. Chronic discomfort needs professional evaluation. These symptoms can disrupt sleep, mood, and daily life. Relief is possible, and your comfort matters. Seeking help is self-care, not overreacting. Listen to your body's signals. Persistent itching or pain deserves a thorough checkup. Let's talk risk factors. Age is the biggest. Most cases occur in women over 65. HPV infection is a major cause, especially in younger women. The HPV vaccine is a powerful preventive tool. Smoking increases risk, especially when combined with HPV. A weakened immune system or certain skin conditions also raise risk. Knowing your risk helps you and your doctor plan prevention. Awareness is the first step to protection. Diagnosis starts with a discussion of symptoms and a physical exam. Doctors may use a colposcope to closely inspect the vulva. If something looks suspicious, a biopsy, a small tissue sample, is taken. Only a biopsy can confirm cancer. If cancer is found, imaging tests like CT or MRI help determine the stage. Staging guides treatment decisions. Bring a friend or family member for support and to help remember information. Your healthcare team will guide you through every step. Treatment depends on the cancer's type, size, and spread. Surgery is most common, removing the tumor and some healthy tissue. Sometimes, part or all of the vulva and nearby lymph nodes are removed. Radiation therapy uses high-energy beams to kill cancer cells, often after surgery or for advanced cases. Chemotherapy uses drugs to target cancer, sometimes combined with radiation. Your oncology team will tailor treatment to your needs. The goal is to remove cancer while preserving quality of life. Side effects are managed carefully. Every plan is personalized for the best outcome. Early detection saves lives. When found early, vulvar cancer is highly treatable, with survival rates over 85%. Late-stage cancer is harder to treat and has lower survival rates. Don't wait. Persistent symptoms need prompt attention. Regular self-exams and gynecological checkups are vital, even after menopause. Trust your intuition. If something feels off, act on it. Your doctor is there to help, not judge. Early action means less invasive treatment and better outcomes. Make self-awareness and regular exams part of your routine. You and your doctor are partners in your health. Let's end with empowerment. The HPV vaccine is your best defense. Get vaccinated and encourage others to do the same. Quit smoking to lower your risk. Practice safe sex to reduce HPV exposure. Know your body and seek care for any changes. Be your own health advocate, ask questions, and insist on answers. Keep regular wellness appointments and don't hesitate to get a second opinion. Share this knowledge with the women in your life. Open conversations and proactive care save lives. Your health is your most valuable asset. Protect it.